The treatment for this disease is what I call the back end approach because you really can't push the immune system down enough to make this disease go away, but you can prevent blood clots in patients by thinning out their blood when they need it or thinning out their blood for a little bit longer. As far as the prognosis of this disease, it really depends on the type of blood clot the patient has and the types of labs that are there. So for instance, if a patient has had some labs that are off, and maybe they've had multiple miscarriages, they don't need a blood thinner all the time, but when they get pregnant, they may need a blood thinner to help that pregnancy go through. Compare that to a patient who has had a major blood clot, such as a stroke or a heart attack or a lung stuff. They may need a blood thinner for a little bit longer. Also, these patients can get more atherosclerotic disease because if you imagine the pipes of blood going to the heart and to the brain, they can get narrow and more narrow as they get blocked up with stuff. And also, these patients can get more heart valve disease.